Hello, everyone. It's May the 11th, Monday. I hope that everyone had a really great Mother's Day weekend. I know surely that 3 families at least, plus the other 51, are surely not maybe having as good a weekend as we'd like them to have for sure. We've now had a 52nd, 53rd, and 54th death. We lost an 82-year-old male in Berkeley County, a 70-year-old male in Kanawha County, and this is really tough, a 25-year-old female in Berkeley County. So, we know this disease attacks the old, and they're the most vulnerable for sure, but at the same time, we now have lost 2 25-year-olds in West Virginia. Of our 54 people that we've lost 2 25-year-olds. So please, as I've said over and over and over, these people have names, and these people have families and loved ones, and please keep them in your thoughts and prayers, and Cathy and I will surely do the same, and we'll some way, somehow get through this. We're fighting it every day. I'll get to the numbers here in just a few minutes. Week 3, we're already in week 3, and this week the wellness facilities, which are gyms and fitness centers supervised by licensed professionals, are permitted to be open. And the Safer at Home order is still in effect. In addition to that, drive-in movie theaters were permitted to be open. Week 4 starts next week, and we're going to really start week 4 in 2 or 3 different ways. We're going to primarily start week 4 with Thursday, May 21st. Now, week 4 really starts on Monday, but these openings are going to commence on Thursday, May 21st. West Virginians absolutely need to stay as focused in every way as we possibly can. The Memorial Day weekend is going to commence. And Jordan, if you could put up on the guidelines, do you have it to put up, the guidelines of all the things that are going to happen on week 4? In week 4, we're going to commence indoor dining at our restaurants at a 50% capacity. We're going to open our large specialty retail stores. Our state campgrounds are going to be open to in-state people only. Our park cabins and lodges will be reopening on May the 26th, and they will be open only to in-state residents at that time. Outdoor recreation rentals, kayaks, bikes, boats, rafts, canoes, ATVs, and similar equipment will be open next week. The outdoor motorsport and power sport, racing with no spectators will be open next week. And the Hatfield and McCoy's Trail, is going to be open on next Thursday. So I would again caution everyone, as we're reopening, surely indoors wear a mask. Absolutely, do everything you can possibly do to wash your hands and do social distancing, and absolutely all you can possibly do to continue to help the elderly and help them with their task in every way. All that will just make good stuff happen to West Virginia. Now, in a few minutes, I'm going to read you some numbers that West Virginia is doing, and the numbers continue to be phenomenally good. And every day that we can continue to pump out these numbers of good, we'll try to push more and more and more things for you to be able to do. Now, with that, you know, and I know too, that the governor, his experts, all the king's horses and all the king's men can tell you, and if you don't do it, we're going to slip back. That's all there is to it. We're going to slip back, we're going to lose more people, and that's not going to be good. So as long as you continue to just do what you've already done, we'll be okay. And we'll just keep pumping out good numbers. Now, one of the things that we're going to do this Friday, Steve McDaniel has brought this to me, you know, our head of our DNR, and to be perfectly honest, it's somewhat of an oversight on our part. But our fishing our guided fishing to where, you know, you have a pretty good sized boat and you have 2 people fishing in the boat and 1 guide, that's the kind of stuff we want you to be able to do. We've got you somewhat separated, and absolutely we would be an absolute advocate of that. And so this coming Friday, we're going to open that up. And you'll see that right there, that there's no more than 2 anglers and 1 guide per boat. And additional guidelines will be published real soon. But on Friday, May the 15th, we're opening that up. Okay. If I could talk to you just 1 second about whitewater rafting. You know, my team is working with the whitewater rafting industry to come up with guidelines to reopen this industry as quickly and as safely as we possibly can, as soon as we can. Look, I get it. I totally get it. I want this industry open and running, up and going. But the health experts in the right, the health experts are really concerned about putting 25 or 30 people in a bus and taking them down the river, you know, taking them to the rafts, picking them up, back in the bus, and while they're in the rafts, you know, you've got 8 people and a guide or whatever jammed in the raft together. All of that really concerns our medical people. Now, I have to defer to the medical people as our reference or our experts. I've asked the whitewater rafting people to work with them. They are. You're doing a great job working with our people. And as soon as we can get some kind of guidelines that everybody can live with and the medical community feels is safe and everything, we'll move forward as quickly as we possibly can, because I want it open. I want it open for sure, but at the same time, I do not want it open if, in fact, we're going to grow a potential problem like maybe that we already have, that we've got going on in Fayette County that we're watching really closely. So we've got to watch. We just got to watch what we do. We're going to move the low contact outdoor youth sports back a week. We hoped we could do it on June the 1st, but now we're going to target June the 8th, and that would be for primarily baseball and softball, maybe soccer, you know, but you know, contact sports like football or basketball primarily, we're probably not going to do that on June the 8th. I've really only got 2 other things, and then I want to talk to you about these numbers just a second. But today is this week is National Correctional Officers Week. Now, you just think about this. I mean, think about the number of positives that we've had in our jails. Think about the great work that these people are doing in every aspect that they could possibly be doing. You know, there's people out there that are just absolutely doing great work. And so I absolutely sincerely want to thank all of our correctional officers and all the great work they do each and every day. And so I, you know, I think this, as of this moment, now don't hold me to this exactly, But I think we have tested 103 inmates or prisoners, and we are yet to have a positive test in our jails. Now, I think that's right, but if I'm off, I'm surely not off much. It's amazing the great work these people do every single day. Now, I ask you to please remember the census and to just help each other so that all of us will be counted. And the last thing I'll end with is just this, and that is, I want you, West Virginia, to always be aware of exactly what's what. And I want you, West Virginia, to know just how proud you should be of what you've done. Now think about this. This right here is a map, and it shows all the deaths by state in this nation. All the states around you, Ohio has 1,341 deaths. Pennsylvania has 3,811. Virginia has 850. Maryland has 1,683. And Kentucky has 304. And West Virginia's got 54. It's unbelievable. The closest state to you has 6 times the number of deaths that you have. You know, from the standpoint of Pennsylvania, they have 76 times the number of deaths that you have. Now, your numbers keep trending the very best. If you could put these graphs up, Jordan, and yesterday, we trended less than 1%. In fact, we trended yesterday less than 0.5%. We trended yesterday at 0.4%. And our overall average for our trending that we wanted to keep under 3, and we've just absolutely knocked it out of the park. But now we're at 2.15. Also, the number of active cases versus recovered. The recovered is growing every day. The actives are running about 521, and the recovered are right at 800. You know, your story, West Virginia, is totally remarkable and a blessing from God above in every way, and a blessing of what you've been able to do, West Virginia. You have tested more. My block right here shows that you have tested more on a percentage basis, significantly more than the nation and every one of your surrounding states. Absolutely. You continue, West Virginia, to make me so proud it's unbelievable, to make the nation in awe of what you've done. Now, you just can't drop the ball right now. That's all I ask you to not do. Just don't get relaxed. Don't drop the ball. You absolutely can see this thing all the way through to its end. Now, just to hang tough, in some way, somehow know that every day that goes by, we get closer to that miracle medicine that's going to give us exactly what we want to protect us. Every day that goes by, the sun helps us in every way. It gets warmer and warmer and warmer. You know, there's one thing I guess that I forgot when I was going through all the stuff and everything is on Thursday, May 21st is when we lift the 14-day quarantine, self-quarantine stuff, and so that'll come off on Thursday, May 21st. So I think that's the only thing that I've forgotten. Again, I congratulate you, And I ask you to please keep all those that we've lost in your thoughts and prayers and everything, because 54, in my opinion, is 54 too many. Thank y'all.
All right, thank you, Governor. Now let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. This week's focus will be on supporting preparation for additional testing in support of Department of Health and Human Resources and our county health partners. Also, we'll provide additional support on contact tracing and epidemiology support, as well as best practices for businesses and other entities that are opening up. Again, there are best practices put out on the West Virginia National Guard website to help businesses and entities as they move forward. We'll also work with the Department of Education and Senior Services on finalizing plans for the summer feeding program. And we'll also continue to work on PPE production internally, as well as additional procurement going forward. A couple of things I want to highlight on Wednesday, sanctioned by the Department of Defense, the West Virginia National Guard will provide a C-130 and a C-17 that will do flyovers at designated hospitals across the state of West Virginia to show our appreciation for our healthcare workers for the great work that they have done throughout this period of time. I would leave you with this as a comparison and to reinforce what the governor just highlighted for us, that we need to continue to double down. If you take the 2016 flood and you use the E-team system, which is the system we use to get tasked for support operations, in September of that year, 3 months into the 2016 flood response, the West Virginia National Guard had been tasked with 120 requests and had 3 requests in the queue. In less than 60 days, 59 days into this event, the West Virginia National Guard in that same system has been tasked with 150 requests and have 46 pending requests. The point I make to all of us, and to reinforce the governor's point, is that behind each of those requests is a mission. And behind each of those missions are first responders, public health workers, our county support partners, our city support partners, and our National Guard personnel, and the many healthcare workers that are working on the front line. We owe it to those individuals to follow the guidance that the governor just established and has established throughout this time, to double down, to don't let up, wear a face covering when you're out with a group or in public, do the things that we need to do, because behind each of those requests is someone who has spent a great deal of time and effort, as well as put themselves on the line to make sure that we are all safe. Thank you, and I appreciate, on behalf of all the guardsmen, if you'll continue to heed the governor's request for those things that we should do going forward. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I have a couple of things I want to discuss with folks that are watching. Certainly, as the governor and General Hoyer both said, I think an important consideration is that people in the state now understand how to protect yourself, how to protect each other. And so as we're doing safer at home, people that can stay home or work from home should. Wearing a face covering that is enough so that you can't see the features of your face underneath the face covering. 60% of people, if we can get that many people to wear that with 60% efficiency, then that will keep the R0 value around 1 in and of itself. And certainly we know that's just part of what we want to do to try to continue to starve the virus here in West Virginia. Continue to do good hand hygiene, wash your hands 20 seconds or with sanitizer, and don't touch your face, your mouth, your nose, your eyes, because that's the way the virus can spread. It's also clear, and when we look at transmission from a variety of different studies, that transmission happens by people that are seated close to one another for a prolonged period of time, particularly being indoors versus outdoors. So as the governor mentioned, we certainly want to see the economy of the state opened up. We have talked in very, very great terms in the past about the concern about people that don't have purpose, that lose their feeling of importance, that lose their connectivity, that feel isolated, feel separated, and we've talked about deaths of despair and hopelessness and adverse childhood experiences. So getting people back to work, to purpose, to connection, to community is very important. But this is an extraordinary time, and we know that we have to do that safely. So as we look at opening different parts of the state, we are certainly focused at trying to do this safely, and the governor has very consistently stated his main concern for the health and well-being of our citizens, to protect their health, but also we know that the economy is important. So as we think about industry sectors like whitewater rafting, we absolutely, myself, my family, love whitewater rafting and want to get back there as quickly as possible. But we really do need to work with the professionals that have these businesses and the industry to figure out how we can do this safely, so we don't expose people to new contacts that sit beside them in the buses or right next to them in mixed families on the raft. So I think that that's really important. Our R naught value, as we've talked about before, this R sub-zero is 0.83 today, was 0.83 yesterday, was 0.88 2 days ago, and then 0.89 3 days ago. So we're marching in the right direction, and we're watching this as another sort of front sign, a sensor, if you will, to help us understand what might be going on that we may not see for a while. And we're watching other states that are opening. And as the governor said, and we know as well, that as we open up, we're going to have more risk of people getting infection with the COVID virus. We know that we have certain parts of our state that have more connection to other parts of the country, particularly the Eastern Panhandle, the Northern Panhandle, Mon County, where we may see more cases because of those border areas. But if West Virginians do what you've done so far, and continue to protect yourself, protect your neighbors, protect your community, continue to keep the curve flat, protect the healthcare workers as we have done and are doing now, then we can continue to open, to flourish, and be beacons for the rest of the country. So I also thank you, West Virginians, for everything you're doing. Keep it up.
Thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Cathy Slim.
Good afternoon, everyone. I want to mention that we had our first meeting, a Zoom meeting, a telephone meeting with our African American Advisory Commission, the task force that we developed to assist us in terms of community outreach and education with regard to this issue. We're looking at several sites in the state. We've already begun testing, and many health departments have already begun testing these populations to date. I'm appreciative of Jill Epson. I want to thank her, Executive Director of the Herbert Henderson Office of Minority Affairs, for agreeing to chair this commission and be part of that. And she's been invaluable for that. So we thank her for her help. Cathy?
Certainly. I wanted to speak a little bit about some new data that's on the dashboard. This Saturday, we added to the coronavirus dashboard the nursing home data for all 123 nursing homes. That includes the summary status of all residents and staff to date, with all testing done to date. Certainly, absolutely nothing is more important than the health and safety of our elderly population, and Governor Justice should really be credited for this first in the nation idea of testing all facilities, so we have that information. All testing of those long-term care facilities has been completed now, and those results are included in what is on the website. Not all of the cases listed on the website on the dashboard were identified during that executive order testing. We'll be doing a more complete report out on the actual findings of that testing later this week. Happy to do that. Just didn't have time today. The majority of long-term care facilities in the state, this is exciting. So the 70% have had no identified cases of COVID-19, And I think that we're one of the first places in the nation to be able to identify where that truly has not been identified as well. So we will look forward to sharing more with you and continue to work with our nursing homes.
All right, thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Slim. Could you give us an update on the testing at daycare facilities? How far along are we? How many are operational? As folks start heading back to work, we get more businesses. I know that's an important component. Could you tell us where we are with that?
Sure. Lots of testing is underway in communities. They are sending that data information back in through local health departments. I don't have the actual number that have been completed at this point, but it is active and underway, and then we are gathering that information as it comes. In terms of numbers of available open sites, those I believe are posted on the Bureau of Children and Families website. So you can see exactly all the facilities that are open and active currently.
All right, thanks, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis, Nexstar Media Group. I'm curious about your confidence level going into the Memorial Day weekend. It seems like we're opening up a lot of things on Thursday, the 21st. We could have thousands of people pour in from other states, some infecting people in this state, and then they get back in their cars and drive home. And there's probably not a real good way to contact trace those. I mean, what is your confidence level that we're not going to have a big spike here after having all these folks coming in Memorial Day weekend? And how are you going to monitor it?
Well, Mark, I'd always be lying to you if I didn't tell you that I'm concerned. I'm going to stay concerned every day. The numbers all tell us that we can do this and everything, and we're going to monitor and stay on top of it in every way we possibly can and everything. And every day that goes by, you know, there's study after study, whether it be, you know, all different people from Harvard to everybody across this nation and everything that's studying this. And I believe we're okay. But I am concerned. I'll be concerned until this thing is gone. We'll watch it every single day. And if we get spikes, we'll react to them. Right now, we look really good, really, really, really good. And so, but at the same time, we're going to stay on top of it. And Clay is going to watch it, and Clay is going to absolutely just stay right with the experts. And he's going to, and as well as all of our health people and everything, we're watching it. That's what the experts tell me I can do right now, and that's what I think we should go ahead and try to do.
All right, thank you, Mark. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. And this is not related to any budget crisis crunch, but it is sort of a question about possible special session in the very, very near future. I know the Senate President just released a statement today talking about legislation that he's working on in regards to, and it's kind of mirroring what the federal government's doing in regards to trying to protect small business owners from what he calls predatory lawsuits, but they're talking about liability issues from obviously some workers going back to work, concerned that they might get infected with COVID, and businesses concerned that they could be sued in regards to that. So, and I know that I know there's a group of Democrats on the House side, I believe, that, and the Senate side, that have been clamoring for special session in regards to different type of legislation, maybe to help businesses get loans, things of that nature. So, as we get closer to June, which I think you had said was sort of the trigger point, I mean, what preparations are we making right now for a possible special session? Thank you.
Well, Stephen, the whole thing is just this. We're still waiting on the rules to come back from the House coming back into session. They're back. And really and truly, what looks like, if you're going to read the tea leaves, and that's what we have to do, you know, what looks like is going to happen is this. There's going to be the ability to be able to backfill for losses from the pandemic. That's all we want to do. That's all in the world we want to do. We don't, and it looks like there's going to be a lot of pushback and absolutely to stay away from taking dollars and funding past sins of decades, pension liabilities and everything that a lot of these states have that are big time problems that we don't have in West Virginia. And so it still looks like that the numbers are going to work to where we'll be able to help our cities and our counties and everything and make our state whole as well as our people. And so right now we're just waiting on the guidelines to come and to tell us what we can do and what we can't do.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question about the feeding program for children, which General Hoyer touched upon in his remarks. Where are we in keeping track of and making sure that the vendors that we're using in these different counties are meeting standards that would be acceptable for our children for the meals that they're receiving? Also, for the costs that are involved with some of these companies, they vary wildly from county to county, where some private companies are charging much more than others and seem to be delivering a product which is much different, and some are complaining substandard to the other counties. And finally, as we hit summertime and move into the fall eventually, are private school students and homeschooled students being included in these programs? Is there a possibility, if they are not, that they would be? And how would all that be coordinated? Because we've had some homeschoolers and private school people reaching out to us asking questions about their participation. Thank you.
Governor, I can cover that if you want.
No, go ahead, General.
So, Kenny, a couple of things. Working with the Department of Education, we also have Chelsea Ruby from Tourism who's been supporting, and others. The Department of Education continues to work with the local county boards to improve the processes as we go forward, to the point of those children who may be homeschoolers or from private schools. It would be those children that, as I understand it, those children that meet the requirements to have the school lunch available, and I can provide you more information on that. We also are working now a plan with the State Department of Education and others to develop the finalization of the opportunity for the county boards to bid on the additional pieces going forward that will start sometime between the end of May and I believe the 8th of June, when school dates roll to official closure across the counties to start the summer feeding program. And I can give you some more updated information on quality assurance and those items going forward.
All right, thank you, Kenny. Next, we'll go to John Raby with the AP.
Hi, Governor. This is John Raby with the Associated Press. I just wanted to ask, I understand that Vice President Mike Pence had a call with the governors today. What did he say about reopening the economy?
Well, John, I can give you a whole update on that real quick, I hope, and everything. The biggest thing I guess we talked about today on the call was this. There's a real movement to encourage, I'm not going to say push, but encourage more and more and more reopening. And in West Virginia, while it looks like that we're reopening things, we're going really slow, really, really slow compared to a lot of others. And our numbers are incredible compared to others. Just imagine this. Now, on the call today, the vice president, we went through a whole ceremony of congratulating, New Jersey on the number of, on their percentage of positive tests to the overall number of tests that they had. They were running at 45%. Now, remember, we're running at 2.15. And they thought New Jersey was doing so good because now, today, they're at 15%. Now, we're going really slow. And we all have got to realize just this. that if the nation shuts down for a multiple of more months, we're going to go into a depression. That's all there is to it. And a depression means really, really bad stuff. It means joblessness. It means starvation. It means all kinds of things that we don't want to even think about. It's where people will have lost everything they had. Everything. Absolutely, it could very well cause millions of deaths. Now, we can't go into that. So there is no choice in the matter but to try to get back to work. That's what the president and the vice president are trying to do. They're trying to nudge us to get back to work. Well, I'm pretty big, and it's tough to nudge. And so we're going to do the baby steps rather than to jump way ahead. Our numbers, any of the states would almost be out of their mind with our numbers. And if they had our numbers, they would say, open the whole state tomorrow. I don't think it's the thing to do. And our people, our experts, our medical experts especially, think we're doing the right stuff. Now, we don't want to get into a situation to where we just are running, chasing our tail with all kinds of bad stuff like a lot of these other states. But the gist of the call was just this, and that is encouragement to do more as far as reopening, encouragement to do more and more and more testing. The other thing that was brought up was this. All the states now, with the guidance of the federal government, are going to try to get every person in all nursing homes in this country tested in the next 2 weeks. Now, from little old West Virginia, I felt like saying, duh. I mean, for crying out loud, we were the first state in the nation to test all of our nursing homes, and it's done. And now, our vice president and others are going in with a unified effort to try to get all of our nursing homes tested in the next 2 weeks. Well, that's what we've tried to do, stay ahead of the curve, and that's basically the gist of the call today. The gist of the call was reopen more if you can, test more, and get our nursing homes tested. And hallelujah, New Jersey dropped their number from 45% to 15%, and West Virginia's 2.15%. So West Virginia, just keep it up. You're kind of rubbing your nose in it, and really and truly, for too many decades and everything, you got your nose rubbed in it, and really now's the time to keep West Virginia shining. I'm really proud of you.
All right, thank you, John. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I wanted to touch base on some of the reopenings. There seems to be a little confusion about what small businesses can reopen and which ones can't, and maybe people getting guidance that they can open and then only to learn that they can't. I was hoping, and I know it's on the website, but I was hoping maybe you could go over who is eligible for that and who is not, to provide a little more clarification. Thank you.
I can go over it. Maybe, Bill, why don't would you like to give it a shot?
I don't have that list in front of me, Governor. I'm happy to do that, but I don't have it with me.
Brian, go over the guidelines of the list, because I just went over it and everything, but this is the guidelines. Put it up if you would, Jordan. Right here. And Amanda's question was, some of the small businesses don't understand if they can be open or not open.
Well, in previous weeks, we've already opened some of the small businesses that had less than 10 employees and had.
Amanda, could y'all hear him? Start all over, okay. Brian.
So in recent weeks, we'd opened the small businesses that had less than 10 employees and also had low contact with members of the public. So those businesses are already open. What we've done here today is by opening the large specialty retail that's some of the stores that you've seen in what typically would be strip mall areas or some of our larger mall areas that have continued to be closed. So now those would be open, which would mean that, in essence, most of our retail industry would now be open as of May 21st.
No, Brian, wait a minute, let me, I don't mean to interrupt you, but our indoor malls are not in this.
They're not in this yet. This is the specialty retail that would be outside. We expect to give some further guidance in the near future on those. They would have a separate category for the mall itself and their best practices, as also the specialty retail stores within inside. Give an example of these big box retail stores would be things like your Dick's or your Home Goods or those kind of stores. So that's the ones that would be opening under this week 4 order now.
This is Bill Crouch. There is guidance on the website for the small businesses as well that was put up last week. So that information is on the website.
Okay. Thank you, Amanda. Next, we'll go to Taylor Stuck with the Herald Dispatch.
Hi, everyone. This is Taylor at the Herald Dispatch. I was just wondering if someone could provide a little bit more details as to why week 4 is going to start on Thursday. Why wait till Thursday?
Well, I could make a stab at it and everything, but what we were trying to do, Taylor, is we were trying to just give us as much time as we could, with whether it be the Hatfield-McCoy's trails or whatever it may be, give us just a few extra days because, people were really most concerned about, the being open and everything before the Memorial Day weekend, and so we just kind of shoved it out to give us a few more days.
All right, thank you, Taylor. Next, we'll go to Jackie Swigart with WVVA. May have trouble connecting with her. Oh, no. Jackie, you there?
No, I don't have anything pressing today. Thank you, though. I'm sorry, guys.
Okay, no problem. How about David Beard with the Dominion Post? David, are you on?
If I can get my mute button. There we go. Yes, I'm here. Thanks. I have a question about, again, the future of testing as you want to move forward to the county level. I wanted to ask if you're considering something like representative sampling for asymptomatic populations as you move to that point. And what do you need to move there? Are you lacking still resources such as testing material? And do you have a possible timeline in mind? Thanks.
I think Dr. Slim, you could go, or Dr. Marsh, and I think.
Cathy, why don't you start and I'll follow in.
Sure, absolutely. So we actually are wanting to make sure we expand testing to anyone who has symptoms, and so any physician that feels clinical judgment-wise needs to be tested, certainly. And then we also are increasingly testing populations by sampling, as you say, with asymptomatic cases. So we are working primarily first with highly vulnerable populations, like our congregate care settings. So our nursing homes, our assisted livings, some of our other, we also are the high-risk settings with our African-American population. So we've been speaking to that issue there. And so we are doing that as a start. We think there are others that we will follow, and we're trying to build in actually more systematic ways of doing this surveillance on an ongoing basis. And that would include over time community-based. In fact, we are looking at areas with high incidence in terms of doing some asymptomatic testing within those high-risk communities that are seeing increases in disease. And there is a broader, longer term there with that, but I'll let Clay speak to some of those issues.
Yeah, sounds good. Thank you, Cathy. So I think Cathy covered it really well, David. The only couple things I would say, and this is really to support what the governor did and what we did as a state. So in 33 states that are reporting nursing home data 14 of those states are finding that over half of their deaths come from people in nursing homes. And as we talked about Sweden, that wanted to slowly allow the COVID virus to spread in their population, they've had a substantial number of their deaths in nursing homes, even though they tried to protect these people. So by going and doing things strategically and looking at the areas that are not only vulnerable, but where the disease can spread very quickly because of the setting, the congregate settings, people living in close opposition or apposition to one another, those are the areas that we know are the most vulnerable for the rapid spread. You know, in other states, meat packing plants and correctional facilities are other areas where things can spread quickly. So I think we definitely are committed to looking at some of these areas that we know give us the highest likelihood of rapid spread, which is what we want to reduce. But also, as Cathy said, we want to look at parts of the state where we see more activity, or where adjacently, like in the Eastern Panhandle, where across Northern Virginia or DC or Baltimore, we see a lot of activity. We want to start biopsying those places relatively consistently so that we start to understand what is the incidence of spread. And as we've talked about, we really want to be able to get this R0 value, this spread metric that tells us how many people are being infected by a single infected person. We want to do that down to the county level. And that will give us a lot of insight on how we operate so that West Virginia is safe, but so that we can make sure that we're paying particular attention to those areas that have the highest vulnerability.
All right, thank you, David. We have time for one more question. We'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. A little more clarification on the retail that can open. You said that malls will not open on May 21st, but can anchor stores with exterior entrances open on that date?
This is Brian. Yes, they could, Phil.
All right. Thank you, Phil. Governor, I'll turn it back to you.
Well, I don't really have a lot to end up with except this. You know, I try to make notes as we're going, you know, to see if there's something that maybe I could be a little more, you know, transparent or clear about. Today I didn't have much, but except one thing, and that is I picked up on General Hoyer saying this, that, you know, he talked about, you know, if we have an incident that happens, it becomes a mission. And then there's guardsmen that go, and they are putting themselves in harm's way for all of us. The same thing is true with our healthcare workers, our first responders. You know, the same is true with our state police and all the different people that are out there doing incredible, incredible work. And then General Hoyer, you know, just basically said, help them. Help them. You know, I mean, really and truly, that's all they're asking. These people truly run to the fire, but we as West Virginians, we got to help them. I mean, for crying out loud, we got to try to do all the stuff we can do that makes our numbers great and everything and helps them. It's not much of an ask. You know, it's amazing. It's always this way with the military. They ask so little and they give so much. It's always that way. They're asking almost nothing again. Just help them. And I know you will, West Virginia. Again, I continue to be really proud of you, and we're going to keep fighting this thing, and we're not going to rest till it's over. And we're going to win this battle, West Virginia. Thank you.